So everybody, we have our Learning About MS Care program tonight. It is a look at wellness. All right, we video recorded this program, so you'll hear about more about that in a minute. But right now, for those that don't know, my name is Stuart Schlossman. I'm president and founder of MS Views and News. And tonight's program, advance to the next slide, please. This program tonight is sponsored by TG Therapeutics, Novartis, and Bristol-Myers Squibb. Tonight's program, this is a wellness program. So this is pre-recorded. So Dr. Ben Thrower, he pre-recorded this program. He will be speaking for about 17 to 20 minutes. Again, it is pre-recorded, so you'll see what he recorded just a few weeks ago. And then Dr. Thrower will be online to answer any of the questions that you may have. Let's get this program started, okay?
Good evening, and thank you for joining us. My name is Ben Thrower. I am a neurologist, and I'm the medical director of the Andrew C. Carlos MS Institute at Shepherd Center in Atlanta, Georgia. I've really enjoyed participating in this series where we're sort of taking a behind-the-scenes look at a comprehensive MS center. What are the various parts of the center and what makes it comprehensive? One of the things we're going to touch on tonight is the concept of a wellness center. Wellness is an interesting concept, and it probably means different things to different people. But the basic idea of wellness, it means that you're participating in activities on a regular basis that would improve your physical or mental health. And so in one of our sessions, we talked about various forms of therapy like physical therapy and some of the ways that they can help you improve function and adapt to challenges. In a perfect world, we would have you participate with a therapist on a regular basis forever. You'd have this ongoing basis. Unfortunately, that is not realistic. Insurance companies are not going to allow that to happen. We all have a certain limited amount of benefits with our therapy visits each year, and it varies from insurance carrier to insurance carrier. So wellness programs are a way of maintaining those benefits, both physical and mental, over a long period of time. And there are a lot of different ways that people can sort of pursue wellness. Here, what we do is when you're finished with your therapy, we might roll you over into our wellness program. Not everyone has that, so you might have to sort of take pieces in your community and create your own wellness program, maybe through an exercise facility. And so that's one of the things we do here also, is we look at maybe someone that lives too far away to come in and use our wellness program regularly. Maybe we show them a program, show them how to use equipment at somewhere like the Y so that they can sort of have these benefits closer to home. As I think about, wellness, sometimes we do classes, things like yoga classes or, Zumba classes, things where, we have one exercise physiologist working with a group of people, very efficient way of sort of reaching out to a large group of people. I would say that one of the greatest benefits I've seen through wellness programs when people are coming together here is the socialization aspect. Some people are socially isolated, and loneliness, social isolation is a health issue. And so recently we were sort of between exercise physiologists as we were bringing a new person on board. So our official wellness program was out of commission for a couple of weeks. We had a group of women who are very regular participants in our wellness program, and we met with them, and they said they were sad that they weren't going to be able to get together as a group. So what we did is we reserved the space and actually had some refreshments brought in, just so that they could still keep their routine just for the socialization part of things. And fortunately now we've got another exercise physiologist and back up and running. So there are a lot of different ways that we can pursue the physical part of wellness. There are online exercise programs if that's a better model for you. Just make sure that you sort of let your healthcare team know what your goals are, and just let's design a program for you. We know that people with MS can become deconditioned very quickly. The sad statistics in the United States are that very few of us actually get the amount of exercise that we're supposed to get. And if you have a health issue like multiple sclerosis, that can present one more potential barrier to getting regular exercise. Another part of wellness may be the emotional part of wellness, and just maybe an educational part of wellness. So support groups can be part of your wellness program. There are a lot of different ways that you can pursue support groups. Different nonprofit organizations that work with MS may have support groups. Your comprehensive MS center may run a support group themselves. Make sure that you're participating in a support group that nurtures you. It's not nice to say, but some support groups can become negative. We sort of jokingly call it pity poker. Well, I've got weakness in my leg, and that person says, well, that's nothing. I've got weakness in both legs. And then the next person says, well, I've got that plus this. That's not a good support group. You want to be there to you can vent problems, but you want to also present potential solutions, or at least positive support. Support groups have a way sometimes of morphing over time, where you'll have certain leaders, then maybe it has a certain feel to it, and then over time the leader changes and it gets a different feel. So if you've been to a support group and you didn't care for it, you might think about trying it again, because you may find that it has sort of changed into something else. If you're an adventurous person and you like being a leader and you don't see a support group in your area that fits you, you can even think about maybe setting it up yourself and looking for support from the various nonprofits to help you do that. Nutrition can be a part of the wellness discussion, and it's an area of great interest in the MS community. I feel like sometimes we don't always know the absolute right answer, and it may be that there's not one right answer for the best nutrition plan in MS. It may depend upon what your goals are. Are you trying to maintain a healthy weight? Are you trying to lose weight? Are you just trying to clean up a diet that's maybe not so great, maybe too much fast food? So working with a nutritionist can be part of your wellness program. They may be able to give you guidance on sort of a reasonable plan. I think back in the decades ago when I started MS training, the hot topic was the MS diet or swank diet. You still see people following that, maybe not as much now as we do, say, the Walls protocol. And all of these different, dietary manipulations have pros and cons associated with them. For me as a physician, what I don't like to see people doing is following a really kind of crazy restrictive faddish diet, something where you have to give up huge food groups, or you have to buy something very specialized, that's not natural, real food. What nutritionists will tell you that, regardless of the diet plan or nutrition plan that you're looking at, there's some basic rules that should be common to all of those. We want to eat more fruits and vegetables. As much as possible, we want to get our nutrients and vitamins from food rather than a pill, with a couple of exceptions, like vitamin D, where we may need to kind of throw in a little extra boost for you. And we want to try to kind of really limit our bad fats, our saturated fats. To me, if you were going to follow kind of one simple plan that might be most healthy overall and part of a wellness picture, it would be something that looked like a Mediterranean diet. To me, the Mediterranean diet is something that you can follow for the rest of your life. You can still have some fun. You can eat things that taste good. You can have a glass of wine now and then if you want to, and it's not crazy restrictive. So again, nutrition can be part of that wellness program for you. So another part of wellness is just being able to get out of the house, socialize, maybe take vacations. So a lot of people with MS, as they have physical challenges, it's like their world becomes smaller, and that's not healthy, and it's not part of wellness. It can lead to deconditioning, it can lead to depression, and that can be a very negative cycle to get into. So we'd like to break that cycle as much as possible. One of the things that we do here with our wellness program is outings. So people may say, I would love to travel, but the airport is very, very intimidating. We actually take groups of people with physical challenges to the airport to try to walk through what that might look like. We might have groups of people that go to the grocery store or to the mall to try to negotiate those different challenges. So talk to other people through MS support groups or online to sort of voice your concerns if you feel like you're becoming physically limited. Talk to your family and tell them you still want to get out and do things. As it relates to travel, there are travel agencies that specialize in people with physical challenges and can actually help you design vacations that might be appropriate for any challenges that you have. Cruise ships can be a great vacation spot. So, other than getting there, once you're on a cruise ship, let's say you're in a scooter. Well, cruise ships are scooter accessible, they're power wheelchair accessible. I have a fair amount of experience working with Royal Caribbean over the years with groups of people with MS, and I can say they're pretty accommodating and they are fairly knowledgeable. So if you were looking at, say, an excursion, when you get to a certain destination or stop port with the cruise ship, they can give you some guidance on which excursions might be appropriate depending upon your level of functioning. So really try as much as you can to not become socially isolated. Reach out, whether it's online, ideally physically going out to places so that you don't become physically isolated. People with MS have families. They may have spouses. They may have adult children. And some of these may serve as your sort of coach, if you will, or your care partner. And this is a delicate dance in my experience. So sometimes in the process of trying to encourage people to be more physically active or to get out of the house more, that care partner may be put into the role of sort of drill sergeant. And that can be both a good and a bad thing. We sometimes see people with MS vent a little bit of anger when they feel like they're being pushed a little bit by the care partner. And so, there's no one-size-fits-all solution for how you dance that dance with your care partner. But we need that person as part of your wellness program. When we do our integrated therapy program, which kind of is like boot camp physical therapy, we really, really encourage the significant other, the care partner, whoever that person is, to be involved in that program so that they are part of the coaching and the encouragement. Sometimes that care partner needs a little wellness also. And so that, exercising together, participating in support groups together is a great thing. And it's a way of sort of, I think, sticking with your wellness program. One of the other programs we have here, if you're coming into exercise and you don't have a care partner who can come with you, is we have exercise buddies. We may partner you up with someone else so that you're encouraging each other to show up and to stick with your exercise program. I think one of the challenges to physical wellness that people with MS deal with is the unpredictable nature of your energy levels and just how you feel on a given day. What researchers have learned with just exercise in general in humans is that it takes a while to form a new habit. So the more you stick with a certain sort of routine with your exercise program, the more likely it is that you're going to stick with that routine. So let's say you wake up one day and you have a certain routine that you're doing for your exercise program and your fatigue levels are just off the chart. What I tell people to do is at least show up. So if it's coming here, if it's going to your basement and working with a piece of exercise equipment, if it's going to your local exercise facility, just show up. Maybe you don't do anything on that given day, but you just keep that routine and keep that habit. The other thing that you have to think about is giving yourself the grace of being flexible with your exercise program. For those of you living with MS, you know that your symptoms vary from day to day. And so what you're able to do with a given exercise program may change one day to the next. And so one kind of idea that may not work well for people with MS is being very rigid with your exercise program in terms of I need to exercise 30 minutes or I need to do so many reps and so many sets of a certain exercise. What people with MS probably do better with is listening to their body and exercising to the level that's appropriate for any given day. The official term for that is perceived exertion rating scale. It's learning to listen to your body. So let's say I'm on a treadmill and I plan on doing 30 minutes a given day. And on this day, at maybe 15 minutes, I'll start feeling a little bit of tingling in my foot and I'm developing a little bit of foot drop. Maybe that's it for that day. I take a break that day. Maybe another day I can go the whole 30 minutes. So being okay with that, with being flexible with your exercise program, I think is an important concept for wellness in MS and maintaining that program over time. So think about your care partners, be kind to each other, keep them engaged. If your care partner needs to be a drill instructor sometimes, so be it. If that model doesn't work out for you, we can have our exercise physiologist or the physical therapist be the bad guy drill instructor. They can take the heat for pushing you maybe to levels that are a little more than you're used to doing. And so good luck with your wellness program. It's an important concept in MS, and it's a little squishy in terms of exercise, mood, all of these things, but it is an important concept. Another aspect of wellness is sort of mindfulness, or sort of just being able to recenter yourself, have a certain amount of calmness to you in a very stressful world. One of the ways that we might achieve that is through meditation. There are great online resources that will help you with meditation. It feels a little Eastern medicine-ish, but it really is something that can help people just to achieve a sense of calmness and sort of just taking a break from a very busy world. You can do this as part of a class. Some people would argue that some yoga classes have a little bit of a meditation component to them as well. So if you're stressed, busy household, busy at work, dealing with the symptoms that MS is throwing at you, think about incorporating meditation into your wellness program. One other aspect of wellness that seems a little strange to think of because it's not the traditional physical or psychological part of wellness, but it's still important, is financial wellness. So MS is an expensive health problem. With our disease-modifying therapies, we really don't have very many inexpensive disease-modifying therapy options. Fortunately, between insurance, copay programs, different sort of avenues, we can usually keep medications covered. But sometimes there are odd things that come up. Maybe you're looking at a piece of equipment that insurance isn't going to cover for you. Think about your resources. If your comprehensive MS center has a case manager, that's a great resource. Case managers are wonderful people. We couldn't run our MS center without our wonderful case managers. And a lot of times the case managers have their finger on that pulse of where the different pots of money are for different things to help you meet your healthcare goals. The National MS Society has navigators, and so these people sort of serve as de facto case managers in terms of helping point you towards different resources to help you get these things done. So financial wellness and sort of not stressing financially is also important, along with these other aspects of wellness. So think about MS wellness in terms of bigger than just your disease-modifying therapy, bigger than just managing individual symptoms with medications. It's the exercise component, it's the nutrition component, it's that psychological sort of support group, lack of isolation component, maybe meditation. And just think about what your resources are so that you can be as well as possible and live your best life with multiple sclerosis.
We have questions for Dr. Thrower, and so one of these is that, so the first one is, does the support group need to have a facilitator, and what are the pros and cons about this?
I think it's a good idea for support groups to have a facilitator, just to make sure you put some guardrails up. I mean, you don't want to have people sort of, one individual, with MS or their support partner, maybe, sort of monopolizing the support group. You want to make sure that it stays therapeutic and supportive for people. I think the other sort of benefit of having a facilitator is that many of these people can be trained. The facilitator could be a person living with MS. Some support groups have a healthcare professional serve as the facilitator. So there are a lot of different models, but I do think having someone to kind of make sure we're staying focused is a good idea.
Great, thank you for that. So the next thing, what is the caregiver's role in a support group?
So the caregiver's role in the support group is, I mean, just to be there for the individual with MS. I think to sometimes serve as sort of another set of ears. How many of us go to a doctor's appointment and we take in all this information, we walk out and now I can't remember anything. And so having another person there just to help you retain that information. I think having a support partner there, a care partner, to make sure that you're voicing your concerns. I think this is true at support groups. I think it's true at medical appointments. Sometimes people forget that, I had 5 things I wanted to talk about and I didn't make a list. And in the support group or in the medical appointment, I only brought up 3 of the things and I forgot 2 things. And so maybe something important gets overlooked. I think there are support groups out there that are specifically designated for the care partner only. And so being a care partner can be challenging for some individuals. And so sometimes having a place where other care partners can kind of say, well, these are some of the challenges I see. What are the solutions you've found? And so they can be the support group can be supporting to both the person with MS and the care partner.
Right. Okay, thank you for that. Next, is it important to have both disabled and not disabled persons in your circle of wellness?
I think it is. It's an interesting challenge. So what we've seen here at Shepherd, I know other MS centers see this, is so we have maybe people who've lived with MS for a long time, and maybe they have some physical challenges. They're using a scooter, they're using a power chair. So the person who's newly diagnosed coming into that waiting room, coming into that support group, it can be intimidating to them. So they're newly diagnosed with MS and they see someone with physical challenges and they go, holy cow, that's going to be me. That is absolutely my destiny. And so there's this delicate dance that we have to do that to let newly diagnosed individuals know that that they may be working with people or in a waiting room or a support group with individuals who have other MS issues, and it's okay. We can learn from those individuals. I think the person who's been dealing with MS can sometimes learn from the newly diagnosed individual. They may have forgotten some of the those initial emotions and struggles that they deal with. I do think there is some benefit in support groups to maybe having a little bit of separation at times, because the two groups of individuals, that their issues can be very different. So while I think it's okay to have a mixed support group sometimes, I do think there need to be other times when those groups are separated. For us, we run programs and classes that are specifically designated to the newly diagnosed individual, and we're almost hand selecting those people. And then we run other classes that are really more dedicated to the person who's lived with MS for 20, 25 years. We might have groups that are focused on, only women only or men only. So yeah, there's no one right answer.
Okay, thank you for that. Next, are there any particular wellness tricks to help someone out of the funk?
I think kind of taking the Nike "just do it" mantra. If you are sort of in that downward spiral where maybe you've got some deconditioning, lack of exercise, lack of energy, maybe a little bit of depression, social isolation, those things feed on themselves, and it gets easier and easier to just go into that hole. You can dig yourself out of it though. So just when it comes to social isolation, I tell people, if you have friends, a church group, synagogue group, whatever, and they say, we really want to get you out to lunch, and you're in your heart, you're saying, I really don't want to do that. I'm too tired. I don't want to. Make yourself do it. You have to break that cycle. And said in the video, it takes humans a bit to form new habits. And so if you've gotten into a habit or pattern of being in a funk, do everything you can to dig out of it. Get out of the house, take advantage of your friends, talk to people, get into an exercise program. All of these things should help kind of get you out of that downward spiral and back into an upward trajectory.
So there is a person that commented online that these MS webinars are a huge part of my wellness programs and and thank you so much for doing it. So thank you for saying this, and I'm glad somebody at least wrote something that I could read from the screen. All right, next, a few different things. Concerning nutrition, a person wants to know, what is the difference between the Swank and the Walls diet, and which one do you think is actually better?
So the Swank diet is so Roy Swank was a neurologist, University of Oregon, a great man. He's deceased now, but he believed that MS was part of the Western diet, that it was too many bad fats. And so the easy way of summing up the Swank diet is a very, very low fat diet, very restrictive. We used to joke that, if you're on the Swank diet and you put something in your mouth and it tastes good, spit it out, you can't have it. It was a tough diet to follow. The American Heart Association would probably love you if you could stick to the Swank diet. Roy Swank collected data on tens of thousands of individuals that followed his diet, and he said that they stuck with it, they seemed to feel better. It wasn't a controlled trial though. There were lots of people who couldn't stick with it and they dropped off, and we don't know, did those people still feel well when they dropped off of it. The Walls protocol. So it's really not the Walls diet, it's the Walls protocol. There is a dietary component, but there's also an exercise component, a stress management component. So it's kind of a little bigger picture. The diet could be best kind of summed up as a modified paleo diet. I would say it's probably a little less restrictive than the SWANK diet. There have never been any head-to-head studies of SWANK versus Walls. Terry Walls, as a person living with MS, I mean, I do give her credit. She puts her money where her mouth is. She is doing studies. There has been a study looking at quality of life and people who followed the Walls protocol for a year, and they did seem to have better mood, better energy levels. She is trying to do just teasing out just the dietary component. One of the challenges and the reason sometimes there's not a lot of data on different diets is diet studies are difficult. If you think about trying to only control that one variable, when in the real world people are taking medicines, changing medicines, and so it makes it tough to just isolate that one diet variable. So again, I wouldn't talk someone out of doing the SWANK diet. I just want them to go in with their eyes open and realize it's very restrictive. If you have a family that is eating in the same household, maybe they may not want to go along for that ride. I don't know that the SWANK diet would necessarily be a healthy thing for children. Children need a certain amount of fats in their diet as they're growing and developing. So yeah, hopefully that helps some.
It does. So now we're going to add another component to that, back to the Mediterranean diet. All right. So which do you feel better, between the Mediterranean or the SWANK or the Walls? I think you might have mentioned it before, but this is now asked now, so I have to ask again.
So I think the Mediterranean, and I'm not diminishing SWANK or Walls at all, but I think for most people the Mediterranean is just more realistic. It's something that you can do for longer periods of time. It's not quite as restrictive. There is data out there that looked at inflammatory cytokines with the Mediterranean diet. So cytokines are chemical messengers that the immune system uses to communicate with itself, and there are cytokines or chemical messengers that increase inflammation. There have been studies that have shown that these inflammatory cytokines do diminish with the Mediterranean diet. So if you made me pick one, I'm a little bit more biased towards that one, just because I think it's a little more realistic.
Okay, thank you. Going back to the physical therapy, if a person doesn't have a care partner to go to physical therapy with, and they're shy, and they're not often, to get out and go to places like a PT center, what can you say to them to make them feel a little bit warmer about this?
So, physical therapists, occupational therapists, speech language, therapists, they're wonderful people. And I can almost guarantee that, a person who has any challenges from their MS, whether it's walking issues, trouble with activities of daily living, maybe dexterity issues, you will get benefit from physical therapy. And I think if you'll just commit to going, I think you're going to see the positives from it. One of the alternatives to you going to the physical therapist is them coming to you, to your home. In some settings, that may be the only option that we have. I don't think it's ideal. When you think about the physical therapist coming to your home, it certainly makes life easier in terms of you not needing to get the transportation there. But they don't have all their toys with them when they come to you. So you think of all the stuff, the equipment that physical therapists and other therapists have. They can't carry all of that with them to your home. So it is a little limited when you have them come to your home. So I would really encourage you, if you can go to a therapist associated with a comprehensive MS center, to me that's the best. Not everyone has access to that. So the next would be a physical therapist in your community who has some experience with neurological conditions like MS. So again, I really encourage people to consider it, because you will get benefit from it.
Yep. So there's a great place in South Florida that if anybody's online from South Florida, that I happen to be going there because of my broken leg and issues with that. And it's a great place to go to, because they're not just about orthopedic, they're about neurocare. and not just physical therapy, but they also have at this place, they have occupational therapy and they have speech therapy and they have cognitive therapy. So, and it's not, again, it's not just for people with orthopedic issues or any one neurologic issue. It's for anybody. Just, if you get a good prescription from your doctor, this would be a great place to go. And they have a number of them around the different counties down here. So it works out. You spoke about going to the airport. Now, this is a good one for you. You want to train people at the airport. What are you going to do to help people learn how to get through TSA?
Yeah, I mean,
especially in Atlanta.
Yeah, I mean, it's challenging. We encourage people to, if you can take a trip with a wellness program, and we have had situations where we've actually let TSA know what we're doing so that we can take people through TSA, even though they're not flying anywhere. We're just taking them through TSA to kind of show them what it's like. That's the ideal situation. I think when people get into, equipment, power chairs, walkers, it's challenging for folks. And I think unless you just do it and then learn what how to navigate around those challenges, it's always going to seem a little bit scary to you. There are travel agencies that specialize in working with people with disabilities. They can certainly give you, pointers on how to do things. If anyone, one of the resources I was not aware of, if anyone has an American Express card, American Express, if you do your travel arrangements through them, it's almost like having, a concierge or personal sort of travel agent of your own, and they can actually give you advice on, navigating different airports and how to get through.
Yeah. So, a lot of the airports have changed in the last year. The system of going through, or your baggage going through the machinery has changed. They upgraded the equipment. They don't require you to have to take out as much from it anymore, because that new equipment, it just picks up every single little thing that you could think that is going to be hidden. It's not going to be hidden anymore. It's there and they can see it. So, I travel the airports all the time. Atlanta airport is one of the toughest ones to go through. And, it's not really because of the equipment. It's not because it's TSA, because there's so many damn people, and that becomes intimidating, and that's intimidating for a lot of people, whether you're an experienced traveler as myself, or, or somebody that even travels more than me. It's stressful to go through there. And then when you have mobility issues, then it becomes a little bit more stressful, and people just want to stay away from it. So my answer to that is, don't go through the larger airports. Try to go through some of the smaller airports. You're better off.
So have you found, Stuart, that having TSA pre-check or global entry makes things a little easier? Because a lot of times with global entry or TSA pre-check, you're not having to take as much stuff out of your bag or take your shoes off or do some of the other things.
Right. So in that case, it's better. But sometimes I find that the TSA lines are longer than the regular lines, because a lot of people have TSA pre-check these days. So it's a pain in the neck. I mean, I was in Nashville a few months ago, and seriously, first off, they're understaffed. So it's not like you could have, just breeze through there anymore either. But you don't have to take off your belt. You don't have to take your laptop out. You can stay in the laptop bag or in another bag or whatever, and just be put into a separate bin and just go through. You don't have to take off your sport jacket if you wear a sport jacket, but if you're wearing a heavy coat, they're going to ask you to take that off, regardless if you're TSA pre-check or not. So, there are a lot of advantages. I mean, there are advantages. People have the Clear now. That's also available. And even with that, though, I mean, there are I have that only because I travel all the time. But even with that, there's so many times I get the random check. And so what was the point of going through that? Because now I got to be checked for, to get through there anyway. So it is a pain in the neck.
Yeah.
But once you're through, I mean, the idea is leave extra time to get to the airport. I mean, that's the main thing. And if you have a connecting flight, don't set it up to be first connection. it's stressful to do that. All right. If your first flight is running a few minutes late, you're going to go crazy, trying to say, when are we getting out of here? When are we going to get out of here? So I always book the second flight. And, 90% of the time I have to fly through Atlanta. And Atlanta airport is huge. We do know that. But I take the second flight. So instead of having to board a plane within an hour and 5 minutes, usually it's an hour and 20 minutes to 2 hours, 2.5 hours. And I'll tell you, I don't care. It's much more relaxing to do that than to have to be going crazy as if the plane's going to get in on time, am I going to get off the plane on time, and et cetera. All right. So that's my give on that. As far as mobility equipment, for everybody to know for the travel, if you use a mobility scooter, you can take that to the door of the plane, and then they will bring that down to the belly of the plane while you are on the plane. And when the plane gets into wherever you're going to next, they will bring that back up and bring it to the door of the plane so you could get back onto your mobility scooter and ride away to somewhere else. Now, mind you, they don't bring it up first thing. Okay, so especially these days it's not just shortages of personnel in the airport, it's also what they call the ramp, or the people that take the baggage off the planes. So that mobility scooter may be the last thing that's brought back up to the jet bridge door, which is another reason why, you would leave and make sure you're on that second connection rather than first, so you're not going crazy to figure out when you're getting that piece of equipment to you. And if you do bring a cane on the plane, just make sure, try to get the one that's foldable. Okay, and I say that because it can fit in the overhead bin or tucked into your seat pocket if need be. But if it's just like a stick and it can't bend at all, if there's no room overhead, and you can't put it underneath your seat. It's just not allowed. So that's just another tip that I want to give you all. There are so many other things. I'm now going to be on a travel. I'm going to be an advocate for a travel board for people with disabilities, because the airports are a mess. Sometimes getting accessible bathrooms or accessible curb cuts and et cetera at an airport is just difficult. Hotels and whatnot. So, down the road, who knows? Maybe you'll see a book from me.
That's awesome.
We'll see. All right. So going on to the next question, with going back now to, where was the question? Sorry about that. Going back to nutrition. How can you help keep a person, is there any specific plan that they can hang on their refrigerator?
I think, if you could look up the basics of any of these programs, whether it's Swank, Walls, Mediterranean, and what you could go into great detail, but all of them have, probably 5, underlying principles that you could certainly put on your refrigerator as just kind of a reminder to yourself and a little bit of a motivator. So I think, downloading that, putting in maybe a little laminated sheet, you can magnet it to your refrigerator. Yeah, I think you can find that online pretty easily.
Okay, thank you. And one last question is about the socialization. With the support groups, do you have any way of getting in touch? Do you have any way to providing a list of where support groups are, like in the state of Georgia or in other states? It's not always available it should be available through all the different MS organizations that have support groups. But do you know of anywhere where there's one list where everybody can find everything?
So if you're going to a comprehensive MS center, you can certainly talk to the case managers at those centers. They should be able to provide you with that list. And they do, these support groups do morph and change, and so that new ones form, old ones drop out. So sometimes even the case managers may not have the very most up-to-date list, but I would look at that. You may have to call each individual, nonprofit, National MS Society, MS Focus or MS Foundation, MSAA, MS Association of America, and speak to all those local folks. Most of these groups have Facebook pages also, so you can certainly go into their Facebook page and talk to members of that group, and there's frequently a moderator on the Facebook page and throw that question out as to where all the local support groups are.
All right, thank you for this. Dr. Thrower, thank you very much for being part of this series. For everybody, again, This is a Learning About MS Care series, and we do have 2 more events, and you'll see them online too. Have a great night, everybody. Ciao.
Good night.
Bye. Good night.